Is it visible?
Yes,
Hello?
it's visible. It's visible.
Yes. Okay.
So we will be start. Sir, we will start in exactly 4 minutes. Okay.
Okay. No issue. Hmm.
So in case you want, you may hide your camera right now.
Sir. Hello? Okay. Yes, ma'am. Good evening.
Yes, Mr. Seshu, we can start the session. It's 4 o'clock. We can start the session.
Good evening. Good evening to all the participants. This is the 30th session on the safety on the session being conducted. I thank the Tata Tiscon for conducting these webinars online because of this COVID. And I thank all the around 400 people are there and online already joining this webinar. I request you please post your questions in the column at the chat box so that I will answer at the end of my session. And if you can ask any questions, if you are not finding any questions now, you can post me at the end of the presentation. My mail ID is there. Then you can post directly to me at the end of after the session. Okay, my name is Seshu Babu. I am working for the past 15 years in safety department, and I'm working for the MMRDA Mumbai for the metro line project line 9. I am in construction for the past 15 years, and I worked in quality for 15 years in the manufacturing industry. So you can utilize my experience in both the areas. Now I'm starting the presentation with a short brief introduction. Please mute your system. So you have any questions, you can write down in the chat box. So this is a COVID. Everybody knows what is the COVID nowadays. We are going through this epidemic in the second wave. Now this is very much serious, and particularly in construction also. Without construction, the infrastructure will not develop. So we have to take more precautions, and we means all the construction workers also a member of these projects. So we have to take care of that. They are also their involvement is much more needed to run the infrastructure projects. So in this presentation, we will understand about the COVID-19, safety practices in the community, how it transmits, challenges in the construction industry, practices in industrial industries now, construction industry. So COVID-19 is a coronavirus disease, as all you know. These symptoms is fever, cough, and difficulty in breathing. It is caused by coronavirus named as SARS-CoV-2. If you have any of these symptoms, then we have to get it tested, and we have to meet the doctors as per the MOE, Ministry of Health and Welfare Government of India. They have given the guidelines, and the numbers are mentioned above. So this is the prevention for this COVID. So it is an invisible disease. Actually, you are fighting with the invisible virus now. So as per the government of India and for the WHO, World Health Organization, we have to be very much hygienic. Actually, in India, we are not following any hygienic conditions. But after this COVID, all the government authorities and as per the world authorities, they are saying hygiene is only the thing which can avoid the virus, spread the virus. So we have to be very hygienic in washing in our hands, This is a new system, so we have respiratory hygiene also be required, because otherwise we will check here, we will throw our water outlets here and there. We will not take, and social distance, particularly in construction industry, it is one of the most unavoidable incidents actually. High risk groups, that means old people, and nowadays all the people below 45 also they are affected. And this is the mode of transmission of this corona. So they are saying wash your hands at least 20 seconds. That is a minimum saying they are saying. Without, if you use the sanitizer, the alcohol based sanitizer. Otherwise, you can use for the best thing is soap is the best thing, because that is easily available and most economic. So this transmission, sneezing or coughing, if anybody is continuously, this water droplets fall on the surfaces, and they, while meeting with other people, in touch, when you are coming in touch with the other people, then it is being transmitted to other person, and that person while eating or that is being transmitted, infected. Or otherwise, if you are sneezing with on the other person's face or other person's backside, and that is droplets are going onto the hand. They see, main thing, hand is the best transmission media. So that means the other person is also getting affected. So hand hygiene, as I said earlier, so washing with the soap water, that is the best one. If it is available, sanitizer is not available, then you go for the soap and use the hand sanitizers of at least 70% alcohol based. It is not completely alcohol; it is alcohol based sanitizer. Nowadays, people are drinking, expecting that it is a completely alcohol. So you are not supposed to touch eyes, nose, and mouth, or with unwashed hands. Touch, particularly the touching the surface in the public areas. If you see the staircases on the lift and escalator buttons, that is the, and toilets also more other days nowadays because of this COVID. That has to be cleaned. That also has to be maintained hygienically. So prevention for the respiratory system, we have to use the handkerchief, or if handkerchief is not available, then put your elbow, sorry, this arm. Okay. Do use handkerchief or tissue or to cover your face while coughing and sneezing. Do throw the used tissue immediately. Now, actually in India, the waste management system, we will throw everything in the bed, even though we are following the waste management rules 2016, that we have to segregate the wet items with the wet waste and the solid dry waste. We have to keep separately, but still we are following, clubbing it together. This is a hazardous, as per the, and that also we are mixing with the food waste items and other waste items because of lack of knowledge and lack of infrastructure, I can say. Do throw the used tissues immediately into a closed dustbin. Do cover all your sneeze into your bent upper arm in case you are not carrying any tissue or kerchief. So we have to follow wash our hands immediately after have covered with the sneeze or cough. And that is what it is a good practice. If you are, do not use a waste to throw the pallu, sari and other kamchas. Don't spit on the open area. Always spit in a wash basin or split area. So these are the challenges in construction industry. Construction delays in project completion. In India, we don't have the statistics as of now, but whereas in UK, they have estimated around 35% of drop in project completion. Actually, in construction, the people contractors will take L1. The one are also giving to the L1 contract only, and time of completion because of COVID, it is delayed, and because of various factors. You can say the manpower, material, and money also nowadays it is a difficult thing in not getting the loans also in proper time, appropriate time. Unreliable supply chain. That means supply chain you are talking about the materials, but post management and challenges. Not only see if you're delaying project completion, then not only in India, if you are going for the any change in the software as well as the hardware. That means if we are going to import any items from in other countries or from other states also, it's not coming on time. But post management challenges, you have seen the during COVID-1 how the people have moved from one place to other place. There is a and people not returned as of now. Then again COVID-2 has started. Now more than 500, 600 people are joined to this seminar. Stress on financial position, as I told in the first point, it is so the output has gone down to 25% in particularly UK. And cyber security. See, nowadays everybody is asking to use the mobile phones and use the inappropriate websites and the internet connections. So this is also one threat for the construction industry. So these are nowadays place of government of India as well as the WHO, as I told, they are asking to maintain minimum distance of 2 meters or 6 feet away from other person to avoid the infection, this virus. And sanitize your hands regularly. How frequently you are touching the surfaces, you have to do the sanitation at the earliest. So these are the control measures similar to the safety aspect. Protecting the workers, start with the most effective methods of protecting. First is hierarchy of controls, it starts with the elimination. That means physically remove the hazard. So you have to find out what is the control measures, if and how to you can modify. If not possible, elimination is not possible, then you have to go for the substitution, replace the hazard. If it is not possible, then we have to go for the control of engineering controls. That means isolation of the people who are going to be affected. Then comes to administrative power controls. That means change of way of people workforce. That means nowadays you would have to change the working times and you reduce the manpower and you ask the people to come in the shifts or changing the lunch times and taking places timings like that. And PPE, as you know, it is a last resort of using the protecting the people. So PPE nowadays, so in the COVID elimination, physically you are not able to, you don't know where is the other, in which location it is there. So we are not going for that. And substitution, you are not able to, when you are not identify the other, you cannot replace it. And isolate the people. Yes, these last three controls, that means engineering control, administrative control, and PPE. These are the three control measures what we are following for the what all the people are following mostly. For this engineering control, that means people are being isolated. That means you are reducing the manpower. Change the people work. Now, if you see, suppose if any in my particular project earlier more than 500 people are used to work. Now it came down to 150. because people, in this case, some people are left and some people are we ask the people to change the location. That means all the people are not being kept in one isolated one area, reducing the manpower and using the more mechanical ways of doing them. And the administrative control, as I told you, next, the last is PPE, the nose mask, face shield, use of sanitizer. This only people are being asked to follow. And after reaching the home or after reaching your residential areas, people are taking bath nowadays. So this is a ventilation, one of the control for engineering. This in the offices it is possible to follow the shields in the while working in the workstations. Drive-through service, plastic sheets and squeezing guards. This, and particularly if you see nowadays the bank people and the public, the persons who are dealing with more with the public, they are using this engineering control by putting the shields in front of them and avoiding directly contact with the people. So this is the administrative control. Enabled 6 workers to stay at home. That means you have to check the physical condition of the people. Establish work from home policies if possible. Because in construction, you cannot do in construction by working at home. Only the design people they can do the work, and some administrative people they can do it. But in actual construction, start with the people and at the particular site only. So minimize the contact with the clients or the other people. Discontinue non-essential works. So particularly if you see the non-essential works, we have to identify the whether you can do after postponing some days. If you can do it, that work that you can discontinue now. Particularly the administrative works that can be delayed. Some of the activities can be delayed. Limiting the number of people for the high potential exposure and training. So training and awareness nowadays, because this coronavirus changing time to time, and the government of India and WHO they are giving the notifications very frequently, and whatever the guidance they're being given by them, we have to follow that, and we have to give the awareness to all the people, all our workers and staff also. And in fact, if you see the office meetings also, they are being conducted online only from the webnet for everyone. The other additional administrative controls, visitor precautions. As far as possible, you should not visit the organizations if you are sick and if you are having fever and any symptoms like COVID. Then don't visit the offices. Visitors are limited. Patients may only have up to 2 people with them at any point of time. Visitors must be above 16 and older. Special expectations, visitors can speak with caregiver about exemptions. You see nowadays every people saying you please come in only one person and then maintain the social distance. Follow the visiting hours. It may be extended nowadays because to change the timings, one must wash our hands and including soft barriers and tables. We may put the soft barriers for giving the warnings to keep the social distancing. Ropes and signboards and floor markings to maintain the social distancing. So as per PPE standard, this is the last resort to conduct the assessment for PPE. That means we have elimination, substitution, administrative control, engineering control, and finally PPE. Provide PPE at no cost, appropriate to the people, to the person. Train employees on how to conduct. See, as per yesterday, in the statement also, out of 100 people, we believe there is the newspaper it came out that only 7% of the people only wearing the proper PPE in an appropriate way, particularly the nose mask. They're maybe putting above the nose, above the head, forehead, or below the chin, just to show that they are following the PPE. But it is not the way. 50% people are not following the same statement. It is there, statistics. It is there. 50% people they are not using the PPE, and the persons who are using it 50%. In that also only 7% people they are using the following the appropriate way of wearing the PPE. So we have to conduct the training, and we have to give the putting the posters in the workplace, and if it is in the office, then you can send some WhatsApp messages that you are not following. And finally, the latest, as per the latest government of Maharashtra, actually in the month of April, they said penalty will be they are penalizing the people actually for not using the PPE in appropriate way. So around 22 crores or something they have collected already from the public, and remaining states are also following the same thing. Mostly, yes, in their latest amendments and rules, they are saying you have to follow this, otherwise we are penalizing. Train the workers to maintain, store, and replace. This is one of the best way. It is one of the important aspects. You have to maintain the PPE, to store the and replace when it is required. We have to inform the people. Otherwise, the mutilated PPE only they are using, because as a owner, if is not providing the users, particularly the manpower, they are using putting in their pockets. Again, in the next day when you are asking to wear the PPE, they will use the same thing where the virus is already existing in the PPE. So maintenance of the PPE is also most important, and where they are storing, whether it is they are putting in the cloths where they are putting, washing, keeping, that is also most important. And when it has to be replaced, particularly the nose mask of medical, if it became wet, we have to replace it. The medical nose mask, we have to replace it. But people are still using continuously and posing their health at risk. And normally nowadays, everybody for the after COVID-1, they are checking the body temperature and oxygen level. So this is also another important thing. We have to check the medical evaluation and testing if required. It has to be followed. That means if the oxygen level is below the 90, below 95, that has to be tested. People. So decontamination of the work areas, because this is an invisible virus. So employees should develop specific decontamination procedure. When the work restarted after lockdown period, Government of India, they given a notification saying that you have to prepare the SOP, safe operating procedures, to restart your activities. Because all the areas are contaminated with the virus for the past 40 days after the first COVID. So they have given for using the material and for your labor camps and so for your materials, particularly the construction materials as well as residential areas, lab is to be done. The sodium hypochlorite, they have declared that this is that is the best decontaminating agent. So that is when how frequently we will decontaminate the area, that we have to mention in the SOP, safe operating procedure. But almost all the companies started and revised after the month of April this year. Depending on workplace, decontamination may require consultation with the health department and consultant specialization for the environment clearance. So disposal is also one of the aspect that has to be covered in the SOP. So we have to use the specified registered disinfection only for decontamination in the material as well as surfaces. Workers and building occupants. See, in India, we are not caring for the workers. So we have in the rooms, if you see any construction site, normally around 15 to 20 people are being occupied in the single room. And maintaining the social distance is very difficult. Not only for staying, for food also, one person is being food and that is being served to the other people. So that is also one of the things which is creating the expansion of this virus. So after this COVID SOP, they have reduced the manpower to a large extent to avoid the spread of this virus. So if we come to the construction area, as I told, the site access and construction areas, material management, governing and reporting, transportation to and from the construction, to and from to construction area, labor colony protocols, training and awareness, and technology intervention. Site access and construction sites. See, nowadays, whenever people are coming, their temperature, body temperature, because and the freezing condition, the oxygen levels. That is a one parameter which is going to be checked. And material management. If the material in the stores is more than came from outside area, then that has to be decontaminated first. That either you are by spraying the sodium hypochlorite or keeping the sun for 2-3 days open area. And if anybody is not feeling governance and reporting, if anybody is not feeling, that has to be reported immediately to the COVID marshals. COVID, every company has declared he is the one person as a one person or more than one person as a COVID caretaker. So we have to report to the COVID taker or to the top management level, so that they will send they will report to the government authorities, and they will Arogya Setu, the government of India has declared that Arogya Setu, you have to download the Arogya Setu app, and that has to be activated. Transportation to and from the labor colony protocols. That means, as I said, maintain the distancing, and while preparing the food, the person if the person who is preparing the food, if he is not feeling well, he has to come out. This is if unless otherwise the persons come out and they say I'm not feeling well, to detecting that person it will be very difficult for the outside persons to say that they are not he is infected with the corona. The sneezing and fever and body pains if severely is there, he has to report immediately. Training and awareness. This is one of the awareness program. We have to conduct to the people, otherwise they will not come, and they will not. Even though they know the system, daily what we are praying God, we have to conduct the awareness programs regularly. To whom they have to report, and who is appointed as a COVID marshal for that area. And because in some other rooms, because of shortage of manpower, one person may be staying in isolated area. He has to inform the other person. Then only people will know. And technology innovation, that means nowadays the drones are you can use for the drones and you will see what is it. So this is how the washing facilities are provided at a distance, maintaining the social distance. COVID compliance procedures and safety manuals to be created. This is SOP is created. Each construction site, contractors and subcontractors are recommended to appoint one or more COVID marshals. Contracted to ensure compliance for their respective staff against set out the procedures. They have to come out, otherwise it is difficult. The site engineer, particularly with the frontline supervisor, he can estimate the person's physical and physical condition. Adequate marking on the grounds. See, you are also following on the shopping malls, particularly on the fashion shop. They have created the markings on the floor. They are asking you to people maintain that system. Similarly, in the workers also, the work area they have to follow that. COVID-19 awareness signages at the entrance and exit, and at the lunch areas. That means whenever you have given the resting area, that has to be there. And at their colony, workers colony area, you have to give pictorial information about the coronavirus so that the awareness they will follow. If you are writing procedure and displaying in their notice board, they will not follow that. They will not read unless otherwise it is a pictorial form. Consumption of tobacco, smoking. Smoking is also one of as per the COVID protocols. Then smoking is enhancing the COVID infection, so that has to be avoided as far as possible. Prohibited as far as possible. Tools and equipments that should not be shared with the other people. If they are sharing, after completion of that activity, immediately they should wash their hands properly, because we don't know. As a standard practice, we have to treat that the people who is in front of you is having the COVID. Then only you can follow the protocols. Otherwise, nobody. That means you are inviting the COVID. Any area, you have to treat that person is having COVID in front of you, or at the back side of you also he is having it. So that you should ask the people to follow the protocols till the epidemic is over. So while transporting people, earlier you might have seen the buses or in the some construction companies, they will follow the highway people. They will transport the people on the highway, and the dumpers they are transporting. If at all they have provided buses to keep the distance, this is the protocol. You have to keep one seat left over at your side. Yeah, that means you have to leave one seat area for to maintain the distance. Screening, sanitization, and safe distancing norms have to be followed. Screening means the thermal screening, and sanitization. You have to provide the soaps at the regular places, and water is also required with the tap. The tap, as well, normally construction here, as I said earlier, will not take people in our line. That means we are not giving any proper sanitation, hygiene condition to the people mostly in construction. And safe distancing is this is also not possible. So that's why we are prepared. The construction companies have prepared the SOP how they are going to maintain the distance, how they are reducing, keeping the distance. Staggered work hours, remote working options. Some for the project management staff and design staff, if they can do it, so that the number of staff which are coming to the offices can be reduced. And if possible, we can do if the relocate the work area, that's the best thing. So working hours also staggered. Instead of coming all the people in the same shift, they are shifted to other timings. Particularly if the people are coming to 8 to 5, 9 to 6, and 10 to 7, I mean, distance is differentiated. Working hours is staggered now. Non-essential visitors are discouraged. Non-essential. So our company is informing us. As far as possible, you can't be in contact with us over the phone only. If it is not required, people are also not allowed to come to as visitor. Vehicles transporting workers is also to be disinfected, because more than you can see the more than 10 people or more than 2 people they are there. That vehicles are being disinfected using the sodium hypochlorite. Temperature scanning at the time of working, entering, and at the middle of the hours also. Workers log. Any workers suspected with the COVID permitted on boarding from the buses and the work areas and reported daily to the safety coordinator. Suitable masks and PPE kits are distributed to the workers. Adequate marking on the ground for maintaining the social distancing and for checking the temperatures. If unless otherwise they are checked, it is not being allowed to come inside the work areas. So this is a, you can see the training and awareness arrangements. Arrangements with contractors to include clause to provide trainings. So this is a compulsory. And staggered with the timings also. The training will be conducted in the staggered training. PPE and other infrastructure to cover ensure COVID-19 safety compliance as per the contract requirements. So this is a newly included agreement, contract condition requirement to work in the any areas. Contractors to update their safety induction, orientation, regular training programs on COVID-19 safety. I am staying alone in this office, so I'm not wearing the PPE. That's my excuse. Contractors to update their safety induction training and regular COVID-19 trainings to be conducted at the predefined frequency. Documenting such as travel documents, travel logs to be maintained. That's why whenever you are going for the any domestic airport, they are asking for the your self declaration. Travel logs to be maintained for all training conducted for review on request. Institutionalized reward and recognition for those who follow the complaint. Unless otherwise you recognize the people, they will not follow. If you are not recognizing, they will say that okay, it is up to the we are following, we are following. If you recognize the people and say display that he is a compliant person, then that will be more effective for any SOPs and any programs. As I told you, register is one app so that you will know how many people are there within your work area. So this is the material management. You see the photos. This is being disinfected on the left hand side and all the three photos. Loading unloading zones to be clearly identified with limited access to concerned teams only. The sodium hypochlorite is a chemical based chlorine based liquid, so it will cause rusting of the material if it is falls on any metallic item. So and if it falls on your eyes, then irritation will take place. So we have to take precautions also for that. All vehicles entering or exiting the site to be disinfected using the wash down chambers. The delivery staff should go through the site access procedures. Shipment documents to be reviewed as far as possible in digital formats. Now, if you see the nowadays all the passport items and the documents from Blue Dot, any courier people, they are doing only digital format, and the exchange of physical format is avoided. If in the permit systems also whatever we are following, mostly digital formats only being followed as far as possible. If the item cannot be disinfected, the item should be stored in separate weather protected area for 72 hours prior to use. This is already mentioned in the SOP. If it can be disinfected, then you can use it easily. Otherwise, you have to keep it in the weather protected area for 72 hours. That means 3 days. Stores to be disinfected daily because most of the items coming and inside and they are going outside, and many people has to handle with their own hands. Construction waste to be removed from site in covered containers and vehicles. Particularly this COVID PPE that has to be kept in separate bins and to be discarded in the bins, and that has to be transported to the recyclers. And it should not be mixed with any food items, food waste, or it should not be mixed with the medical waste. that is a biomedical biohazard waste. The handlers should be have the appropriate the permission from CPCB. So labor quality protocols to go for the washing facility and sanitizer, keeping the social distance, and assembling point, the assembly collection of people at one place. For the training also now we have avoided conduct in one area. We have separated people, not more than 5 people will be at the one place nowadays in the construction areas. But to keep the social distancing only. Beds for labor to be earmarked. Hygiene protocols for common facilities, that is dining rooms, restrooms, etc. to be implemented. That also needs to be disinfected at regular frequencies. Labor colonies to be cleaned and disinfected on a daily basis. Install additional hand washing stations with clean running water and soap at common locations. Hand washing stations to be discharge the COVID site drains. Do's and don'ts posters at colony premises in language spoken by the workers. I prefer it should be in the digital pictorial form with the girl photos and ladies photos. Then only it will be usually eye catching. Labor camps to be fenced and secured, especially for large sites with visitor entry in man and restricted. And training and awareness arrangements with the contractors to include clause to provide required trainings. And monitoring also is required. PPE, other infrastructure ensure COVID-19 protocols and safety compliance as per the contract requirement. Contractors to update their safety induction orientation program and regular training programs to include topic of COVID as a special condition. The COVID-19 safety trainings to be controlled at predetermined frequency. Documentation including training logs to be maintained for training conducted and be readily available for review upon request. Necessary loading and other unloading areas that has to be disinfected. And this is a minimum requirement, and mainly the monitoring of physical condition of the people is most important in the construction activities. So this is a technology innovation. So earlier we are using the contact thermometer. Now contactless came now. Now it is the thermal infrared cameras to check the areas. Digital scanners for recording of staff attendance, documenting questionnaire response in an electronic database may be deployed. This is a technology you can implement it in your work areas. Thermal imaging scanners may be deployed for easy temperature screening of a group of individuals. Artificial intelligence and advanced algorithms on visual fields can be used for PPE monitoring. And drones for disinfecting of the areas. Drones with options to spray disinfecting on an isolated risk. So you are avoiding the physical contact of the people with the chemical. Important precautionary, and this is very fast compared to other areas, other manual disinfection. So I request and anybody if is not feeling well with the fever or with the body pains, that has to be brought to the COVID marshal for his action. So that the action will be taken first. That person's name and his contact number should also be displayed in the work area. Select members of management and owners. Daily, weekly, monthly reports. This has to be reviewed by the COVID person or any other administrative person. to analyze the reports and to find out whether anybody is more persons are infected and reason for to avoid the reason for that so that he can maintain they can be action will be taken. All meetings of the project stakeholders may be mandated to start with the status of COVID-19. So this is another good practice. Like if you are anybody starting daily, we are doing a daily monitoring, and that being any meetings is being started with the COVID latest information and awareness. So this is one of the best practice. If you can able to do it, good. And I would request you if it is being talked in the beginning, then all the people, if it is not a single person duty to find out everything to find out. So all the people can be brought awareness to the people. Safety compliance highlighting the importance of worker safety. If the worker is not there, there is no construction actually. The person will not do anything. That means worker is not there, you cannot. Can you conduct any construction activity? It is not possible. Update the site precautions, including compliance checklists to include measures to be adapted for COVID-19 safety. Updated job description, key performance indicators, the respective staff, including COVID-19 safety coordinator, in line with the revised documentation. So this is one of the best practice. If you can able to do it, very good. So these are the how social distancing and monitoring of the attendance being conducted to other people. On the left hand side, on the middle is sanitizer, and the thermal screen scanning of the people. So this is how the offices are being disinfected, and lab colony is also disinfected with the same thing, sodium hypochlorite. On the work areas also, this is the left side, it is stores and toilets. For the particularly toilets has to be disinfected regularly, maybe at least 2-3 times, depending on the people who are using. And this is a labor colony. First one is a labor colony residential area. And the cars, particularly the staff who are using the cars, this also being disinfected by the people. If you have any questions, please post here so that I will be able to answer. If not possible, then you can send me so that I will answer. Thank you for all for your valuable time to conduct this webinar. Thanks Tata Tiscon for giving the time and of all the executive people and others spending their time for giving that. Thank you.
Sir, did you get the access to the questions?
Yes, sir, but questions are not there. I'm not able to see any question. Sir, can you show me? That's what I'm doing. There are no questions. Is there any hope for getting job in steel structures for civil engineers? Sharad has asked the question, is there any hope for getting job in steel structures? The structural. Is there any hope for getting job in? Yes, it is there. The steel engineers, structural engineers are there. They are doing job. Sir, one question is there: is there any hope for getting job in structure? Thermal scanning
Sir,
issues as people. Hello.
yeah. So can I mention a few questions? There are a lot of
Yes, sir.
questions coming in. Yeah.
Yes, sir.
So what is the tentative? One second. Um, One second. Um, yeah. Uh, what is the interval testing for COVID which is recommended for the site people? At what intervals should the testing for COVID take place?
So testing frequency, it again depends on the people, how many people they are working in the same area. Actually, in construction, as per again depends on the SOP, standard operating procedure. That means based on the activity and other collection of people, how many people working in one place. They are saying every day that has to be inspected, and as per the latest rules, that is the only thing, sir. If the more than 4 or 5 people are there, it be that too. It is being highlighted after 4 or 5 days. Once the person has got infected, then that's why they are saying daily we will check the temperature.
Okay. So one person is saying that thermal scanning has some issues where they are used thermal scanning, but
Yes, sir.
there are some issues with thermal scanning.
Yes, sir. Thermal scanning, actually the calibration of the equipment is most important, and the temperature in the location where the people are being temperature monitored. If you are the persons in the hot area and they are using the thermal scanning, then it will be difficult one. The normal area where there is no forced air and for in the hot weather is not there, then only it has to be checked. Otherwise, the temperature will affect that surroundings will affect that the scanning issue.
What about the how should we go about disinfecting the canteen areas? Can infection be spread through cooked food and vegetables? And how can we sanitize these areas?
The vegetables, this is a good question. Actually, in the vegetables, they are being disinfected using the salt liquid, salt solution. And for the workers, the lunch area, we should not allow all the people at a time. We have to stagger that lunch area. And after lunch of the people, that has to be disinfected using the sprayer, this sodium hypochlorite. That is otherwise people are saying it is flying in the air. That is most important requirement. That canteen area particularly. As I
Yeah.
told in the beginning, all the persons you have to treat, the person is having the COVID, then only you can take the precautions and corrective measures.
Yeah. Should smoking be allowed at the site? Can the coronavirus spread by a smoker exhaling and the fumes spreading over long distance?
In the notification, they said this one, sir, you are not supposed to smoke in the open area. That's what otherwise it is spreading the coronavirus. That's what the people are and the doctors they are saying. It is flying in the air and exhaling. That that is the most important. They are saying avoid smoking in the open areas.
One of the participants has a lot of challenges relating to material handling. Can you give some tips related to material handling for in the COVID scenario?
So, yes, particularly the tools and tackles. That means it should be issued to the individual persons. As far as possible, it has to be given to the each and every worker, so that changing of the tools will not take place. And use the mechanical handling as far as possible, because earlier we are 50 up to 55 kg the man can lift as per the MOC this factory act. If possible, if we are using the mechanical means, that means using the forklift or using the hydra, if we can able to do the ship the material, that is best one. So that contact will be less. And similarly, if the machines are being idle or it is being transferred, shifted from one place to other place, after reaching the work area, it should be disinfected using the sodium hypochlorite, so that we can reduce the spread of this COVID in the world during the handling.
Okay. Yeah.
And
So
particularly
for
while shifting from steel material from while incoming material comes here, that has to be disinfected. Then only it should be allowed in the work area. We should treat that this is having infection of virus over the surface. Sir, you are talking something.
Yeah, what is the financial implications of following these safety precautionary norms at construction sites? What are the financial implications?
So, as you see the financial implications, now it has enhanced very much. Around 20 in the UK, as I showed you, 25% their financial implication is there. 25% because of maybe reduction in manpower or delaying in the projects and reduction in the you're not able to meet that project in time. There is 20 up to 15 to 25%. 25% they have given. Implication is there.
So, could you give us some tips on governance and reporting? How can we make the governance and reporting very nice?
So recording of the whatever you're taking the precautions like thermal scanning and the physical pictures, if we can take the pictures, that is one of the advanced technology. And the recording of temperature recording and this report on the other physical activities report.
Um, can you give us some more suggestions on engineering controls over site to reduce the spreading of COVID?
In construction,
Sir, one more question. Sir, this is the last question because we are out of time right now. There are a lot of questions which are pouring in. So, in the construction, keeping material idle for more than 72 hours is not possible or it is very difficult. How do we tackle this kind of problem? It is not possible to keep the construction material idle for 72 hours or it's very difficult. How can we tackle these problems?
so to avoid that only the disinfection has to be done, sir. If disinfection is not able to done at the time of arrival, then it is a delay, or otherwise that is being followed wherever urgent material is required, then that is followed. Disinfection using the sprayers.
Yes, so sir, we are out of time. So I'll send you the balance questions on email. It is a lot of questions are coming in, but we cannot take it because we are out of time. So I'll be sharing on email with you.
Okay.
Okay. So yeah. So you may close the webinar. You may thank the audience and close the webinar.
Thank you. Thanks the Tata Tiscon for giving the valuable time. This is the 30th session, as I told you in the beginning. So I thank all the participants. More than 600 people, 650 people are there and attended. Thank all the each and one and every people for attending this webinar. Thanks for giving me the time. Thank you, sir. My mail ID is there in the next slide. This is my mail ID. Hello.